Okay, let's dive right into this. Welcome to the Explainer. Today, we're serving up your ultimate survival guide for what to do when you suddenly realize your Medi-Cal card has literally vanished into thin air. If you've just lost your card, hey, take a deep breath. We're going to replace that panic right now with a super clear, step-by-step action plan. Picture this real-life scenario, right? You've got an urgent doctor's appointment tomorrow morning. You open your wallet to grab your ID, and your stomach just completely drops. That little piece of plastic you rely on is gone. And let's be real, Medi-Cal, which is California's Medicaid program, is absolutely crucial. It's the system that provides essential health services for millions of low-income folks. It's not just paperwork, it is a literal lifeline for care, medications, and treatments. Losing that card is incredibly stressful, but I promise you, by the end of this explainer, you're going to know exactly how to fix this without missing a single beat.
And listen, if you're feeling a bit frustrated with the system right now, you are absolutely not alone. Look at this real field report we pulled from Reddit user Rebel Reborn 909, who wrote, "Approved in March, still haven't received packet or card in mail yet." Missing cards and systemic delays, they are so common. State bureaucracies are absolutely massive, and sometimes things just get lost in the mail or stuck in some random processing queue. So your frustration is totally valid. But the good news is, we have workarounds.
So here is our roadmap to get your access restored. First, we'll cover the missing card crisis. Then, 3 ways to replace it. After that, navigating Benefits Cal. Next up, some insider tips and troubleshooting. Then we'll hit FAQs and timeframes, and finally, we'll talk about why you are still covered. All right, Section 1, the missing card crisis. So, before we go requesting a new card, we really need to demystify some of this confusing government jargon, just so you know exactly what piece of plastic you're actually replacing. When the state says you need a new card, they're usually talking about your BIAC, or Benefits Identification Card. Think of your BIAC as your master key. It's a permanent plastic card that's tied directly to your master file in the state's Medi-Cal eligibility data system, often just called MEDS. This isn't just some generic ID, it is the digital anchor that proves your eligibility across the entire state of California. Now, let's break down the difference between the 2 cards you might have. On one side, you've got the state-issued BIBIC. This is your permanent MasterCard. It has a 14-character ID, and you literally only replace it if it's lost, stolen, or damaged. On the other side, you've got your Managed Care Plan ID card. This one comes from your specific health network, like Blue Shield or Community Health Group. This Managed Care card is dynamically updated, meaning it gets reissued whenever you change your primary care doctor or add a dependent. So rule of thumb, if you lost your specific health plan card, you got to call your plan directly. But if you lost your master state BIBIC, you're going to follow the exact steps we're about to cover. Which brings us to Section 2, 3 ways to replace. Let's look at the actual administrative avenues available to you right now. You basically have 3 primary ways to get a new card. Number 1, online through the Benefits Cal portal. Number 2, over the phone, directly with your local county agency. And number 3, in person at a local human services office. Now, while picking up the phone or walking in are fantastic backup options, we highly recommend the digital route. It is usually your quickest starting point, and it totally avoids those agonizingly long hold times. Moving right along to Section 3, navigating Benefits Cal.
What's really cool is that the state actually streamlined what used to be a super fragmented process into one unified digital portal for all 58 counties. It's surprisingly simple. Step 1, just log in to benefitscal.com. You are going to need to pass a quick 2-step verification using the email or phone number tied to your case. It's a minor hoop to jump through, but it's a crucial security measure to protect your medical identity. Step 2, navigate over to your dashboard and look for support requests. Step 3, from that drop-down menu, simply select Benefits Card Replacement.
Once you click that, the system is going to show you a confirmation screen. It automatically pulls up the current mailing address they have on file for you. Look at this very carefully. If you've moved recently, your new card is going to be sent straight to your old address. The portal will actually prompt you to stop and contact your county office directly to update your file first. Seriously, do not skip this check. Now, if your address is perfectly correct, you'll be taken to the next screen where you just check the box next to whichever household members need a replacement card. You can select just yourself or multiple family members all at once. Hit that Request Card button and boom, you are done. Your request is officially in the state's batch processing system. Easy, right? All right, Section 4, Insider Tips and Troubleshooting. But hey, what happens when the digital route just isn't fast enough? Or maybe the system is glitching out on you. Check out this brilliant workaround from Reddit user PossibleElk6029. They say, walk in and tell them. They will get someone to solve it in real time. It's so true. Call center agents often just transfer tickets around, but physically walking into your local county office, that puts you face-to-face with a real human caseworker who can actually access the state database and push your request through immediately. And here is a little-known insider secret for you. If you are in a genuine crisis, like say you literally need to pick up life-saving medication this afternoon, go straight to the county welfare office and explicitly state you have an immediate need. Under that specific exception, they can actually generate a temporary paper card for you using Form SCD-1233. In these extenuating circumstances, local offices can physically print this for you right on the spot, or even send it to you via a secure encrypted email. You absolutely do not have to wait for the mail if it is a true emergency.
Section 5. FAQs and timeframes. Let's tackle the most common questions. So, you've submitted your request, and now you're probably staring at the mailbox wondering, okay, how long is this going to take? Well, here is the exact mandated timeline. It generally takes about 2 workdays for the state's electronic data systems to process and manufacture the new plastic BIC. From there, expect about 2 to 7 working days for the post office to actually deliver the state BIC to your front door. Now, if you also requested a new managed care plan card from a private provider, they use commercial timelines, which usually take 7 to 10 business days. So definitely mark your calendars and keep an eye out.
But wait, there is some absolutely fantastic news on the horizon. Coming in February 2025, the state is rolling out a brand new, massive system update via Covered California. You will soon be able to log in right from your living room and instantly print out a Medi-Cal eligibility confirmation letter. This document is going to function exactly like a temporary paper card, complete with your ID number and issue dates, completely eliminating that agonizing wait for the mail carrier. That is a huge game changer. Another huge question we see literally all the time. How much is this replacement going to cost me? The answer is a beautiful round $0. Under state and federal guidelines, there is absolutely no administrative fee for replacing a lost, stolen, or damaged Medi-Cal card. If anyone, anywhere ever tries to charge you for this online, you are 100% on a scam website. Close the browser immediately. Finally, Section 6. You are still covered. I really want to empower you with this crucial point. Your healthcare exists safely in a secure database, not just on a flimsy piece of plastic. Here is the ultimate fix if you find yourself at the hospital or clinic today. Just walk right up to the registration desk and provide your social security number along with a valid photo ID, like your driver's license. Hospitals and major clinics are directly tied into the state's meds network. They can look up your active coverage in real time. That plastic card, it's really just a convenience. Your social security number is the true key to unlocking your coverage.
And honestly, providers are legally bound by a state protocol called the good faith effort. If you show up without your Medi-Cal card, medical providers must make a good faith effort to verify your identity using an alternative photo ID. They just make a quick copy of your driver's license for their files to prove you are who you say you are. You will not be turned away from necessary medical care just because you accidentally left your BIC on the kitchen counter.
And to offer you one final layer of deep reassurance, remember this golden safety net shared by the community. No matter what, you can get retroactive coverage for 3 months before your application date. Even if you end up having to pay a medical bill out of pocket while you're sorting out bureaucratic paperwork or waiting for your shiny new card to arrive, Medi-Cal's retroactive billing safety net is there to catch you. You won't be left holding the bag for covered emergency expenses.
Well, that brings us to the end of our roadmap. A quick disclaimer, the guidance in this explainer is based on the latest available state information, but individual county processes and personal cases can always vary a bit. Always consult your official county resources or a professional advisor for your specific circumstances. If this structured breakdown helped lower your blood pressure today, please share this explainer with a friend or family member who might be silently struggling to navigate the whole Medi-Cal maze. We want everyone to have the access they absolutely deserve. So I'll leave you with this final thought. Now that you know your health coverage is permanently tied to you and not just to a piece of plastic, what's stopping you from booking that checkup you've been putting off? Thanks so much for joining me today. Stay focused and stay informed.